I want to talk about something that's completely misunderstood all the time. That's called sciatic pain or sciatica. Anytime somebody feels pain down their leg, they think it's sciatic pain and they have a disc herniation and they should get surgery. And really, that's just not the case. This is only part of the spine. It's missing the pelvis and the sacrum. But here's the cervical spine, the thoracic spine, and the lumbar spine. And these three nerves down here, L3, 4, and 5, when they come out and then coalesce, traveling through your gluteal area, that produces collectively the sciatic nerve. So when you have pain down the leg that's truly from a sciatic nerve, generally speaking, it's an entrapment in a big muscle in your behind called the piriformis, because the sciatic nerve actually goes through that muscle, and the muscle when tight can pinch it. And then the pain down the leg is notable and may even extend past the knee and really, really hurt. And the treatment for that is to stretch the piriformis, but also to pay attention to the joints the piriformis is attached to. In this case, the sacroiliac joint is largely influenced by the piriformis, or influences the piriformis. So loosening the sciatic joint can minimize some of the sciatic pain. And then sometimes, in truth, you can have that sciatic pain from a pressure on the disc, putting a direct pressure, let's say on L5, and contribute a bit to what looks like sciatica. So it can come from the back as well. But most of the time, sciatic pain can be treated through mobilizing, improving strength, massage, manipulation, taking the pressure off the nerve that way. So it's pretty nice to know that sciatic pain can go away in that regard. Then there is something that we call sclerotogenous pain, that who cares what it's called, but it is that pain that we feel in our leg or our arm. It's a deep, dull ache. It's not nervy, it's a deep, dull ache, and it's kind of hard to pinpoint. Sometimes you just say, I don't know, it's really deep in my leg, or it's really deep into my arm. Sclerotogenous pain, at least in the leg, can mimic for a lot of people sciatic pain. It feels like sciatica. You think it does. You've never had it before, but you think it is. But really, that sclerotogenous pain is from a joint that is restricted in the spine. When that absent mobility, fluidity in the joint is present, that will cause what we call a referred pain into the leg, sclerotogenous pain, and the treatment for it is to manipulate and open the joints in the spine that are fixated, causing that pain pattern. So I guess my point there is, when you have pain down the leg, if it is sciatica, you likely will be able to treat it with massage and manipulation and stretching and getting stronger. And if you have sclerotogenous pain, the easiest way to treat that is through manipulation of the spine and opening those joints that have gotten stiff and locked down. So I hope that helps and maybe reduce some of your angst around leg pain.